Many times when I ask my patients how have they delivered in their last pregnancy, they tell me that doctor, I was induced and I was having pain, but for some reason I was, taken for a cesarean delivery. So what are these conditions if you want to know? Do we really have to abandon the process of labor and take you for a cesarean delivery? Answer is yes, because these are we just lead you to this process of delivery, and we keep monitoring for things. So there has to be a progressive forward thing going when you are laboring. That is, the cervix has to fully open. Simultaneously, the head of the baby keeps descending down. And then finally, when it descends well enough, it hits the pelvic floor of muscles, and that is when it turns over. And it has to be in a favorable plane for the head to slip out. So in this entire process, depending on a lot of things, a lot of factor from your bony structure to your muscle power and stuff, something somewhere can become very slow, or it can become it can just stop. So there can be sometimes, very slow descent or a very slow progress of labor. Sometimes there can be arrested movement of the head wherein it has not rotated. So these are the conditions where when we know it's not making a headway, that the only way other than this to deliver you is cesarean. The other thing, sometimes, what happens is you're always on a monitor in our hospital when you're laboring. So we keep monitoring your uterine contractions with the baby's heartbeat. There are times when the baby shows signs of distress. The heartbeat seems to just dip down, and these are things which can herald some bigger problems in the baby. That means, maybe the baby is not getting enough oxygen supply, and then because of this, it can have acidosis and serious metabolic problems. So these are conditions when we come to know and we diagnose that you're better off to deliver with a cesarean, so that in the end we have a healthy baby and a healthy mother. So we have to abandon the process of labor, normal labor, and take you for a cesarean delivery. So the bottom line would be, how would you know? You just leave it to your doctors to decide. Please trust us with whatever is happening. Though we here at Aster RV, we really encourage you to deliver normally, and we have an entire program which is to get you ready for this. We have regular antenatal classes and exercises and diet counselors and physiotherapists to take you through. But for some reason, if it's not working out, you may be put to a cesarean delivery. Here at Aster RV Hospital, we've had a great run and a great experience delivering our patients normally. I have about 20 years of experience, and it is all the more possible here because we have a team of wonderful doctors here in the Department of Obstetrics. So, our cumulative experience, if you ask me, is more than 50 years. So we are here to help you, and we have a great team of doctors in different specialty. So there was a phase when we went through this COVID that people needed ICU admissions, and then it needed a pulmonologist's opinion or a physician's opinion. So it was all available to us at the drop of a hat. And to the extent possible, we took great care. We also have people to aid you through your antenatal exercises, diets, and other various programs, your breastfeeding, programs that we have here. So I will say, now with more than about 500 deliveries already to our name, we are going stronger. We would want you to, come here and share the experience of delivering with us, and we are always here, happy to help you.